Hello everyone, this is Captain Klein, and this is the first of my question and answer sessions in response to the coronavirus pandemic that currently is sweeping across the world. COVID-19, as coronavirus disease is known, is a pandemic that's constantly changing. However, I want you to know that I'm fully committed to providing you with the best guidance that I can, when I can, as often as I can. So that's why today's video is so important. You may have gotten an email from me last week, and I'll be sending another one out to the email addresses you've provided when we first changed our work policies so that I can communicate with you directly and give you a link to this video. As you know, the situation is very dynamic, and I ask you to remain flexible. I know and deeply appreciate the work that you are doing and the commitment you have to the work that we do in support of our global missions that are continuing to be conducted around the world, around the clock, in defense of our country. So each week for the duration of this pandemic, I do plan to post a video in a Q&A format like we're doing today, covering topics of interest to our sailors and civilian personnel. I encourage you, if you have questions, to feed those up through your chain of command to me, work with a public affairs officer, and we'll try to get it included in one of our videos or in an email communication to you. So the topic of this week's question and answer session is protecting our workforce. So I do have several questions that I'll go through that I hope will help clear up any confusion that might exist. But please, if it doesn't hit the mark, provide me that feedback and I'll clear it up in a subsequent video. So we'll get on to the first question. What measures is the installation taking to ensure that sailors and civilians are safe in the workspace during this pandemic? Well, the first thing we did back around March 20th was to aggressively implement a situational telework policy. And that was designed to reduce the number of personnel in our workspaces so we could achieve the social distancing goals that were put out by the CDC and our headquarters at the Navy Region and Navy Installations Command. Additionally, we fully implemented all the federal Navy guidelines for social distancing and workplace sanitation. We've moved to virtual service to the maximum extent that we can for those critical services that we need to continue. And we have temporarily closed services that were determined to be non-mission critical at this time, such as gyms and certain food and beverage services. Finally, we've aggressively implemented our self-monitoring program for all of our personnel. Additionally, in accordance with our headquarters and Office of Civilian and Human Resources guidance, boy, that's tough to say, OCHR, we'll go with that from now on. So in accordance with the headquarters and OCHR guidance, last month we began using the Centers for Disease Control guidelines to allow members of our workforce at a higher risk of infection to self-identify. So those who self-identified were provided a couple of options. One, they could continue working if their workplace supported social distancing and they felt comfortable doing so. They could begin teleworking if their position supported telework options. We call that situational telework, so it's a little bit different than our normal teleworking. And then if their situation didn't provide them the social distancing or a telework option, then we have the option to use administrative or weather and safety leave. And we've done that to a great extent. So this applies across our entire workforce, military, NAF, and APF personnel. A couple important things to know about that. So first, the CDC regularly updates their guidance on high-risk personnel and the categories that apply. And that results in the HR and OCHR and our legal folks reviewing and updating our guidance. And so the categories have been added and removed, and our guidance continues to change to match that. So as OCHR and CNIC update their understanding of it and provide us guidance, we do change our policy, and that has resulted in some folks, the category being removed by the CDC and those folks being asked to come back to work. Now every situation is different, so if you do have an issue that you need to discuss, take that up directly with your supervisor and we'll work through it in this very uncertain time. But I ask that you remain flexible because I know these policies are going to change again. But what won't change, I mentioned this earlier, is my commitment to ensuring that you have a safe and healthy work environment. There will come a time, though, when we have to begin to reopen our services. And when that happens, I promise we'll do our absolute best to balance the health and safety of our workforce against the safety requirements of our personnel and those mission-critical functions that they have to perform. So our boss, Fleet Forces Command Commander, referred to that as the risk. CNO referred to that as the risk. The risk is the balance of the safety of our workforce, the health and safety of our workforce, and the need to perform those mission-critical functions in defense of the country. So I thank you for your commitment to our mission, and I know that everybody has that interest in. Okay, so questions 2 and 3 are somewhat related. I'll read both of them for you and then we'll go through and answer it. So question 2 is, will all sailors and civilian personnel be screened to ensure they are free from any illness prior to coming to work? And question 3 is, if it's discovered that one of the personnel has a fever, what will be done? So in accordance with NAV North Fleet Forces Command Phase 3 Execute Order, we, along with all commands on the installations and across the Navy, have implemented the screening criteria that was provided by NAV North. There are 4 questions that you're supposed to answer before you come to work or before you enter any building. So we have stations set up at the entrances of all of our buildings. All of our tenant commands should be doing the same thing. And the intent is that before you even get in your car to come to work, that you've answered those 4 questions. 1, are you currently sick? 2, have you traveled internationally? 3, have you traveled domestically? And 4, have you had close personal contact with anyone who's been diagnosed with COVID-19? So if you answer yes to any of those questions, particularly the currently sick, international travel, or close contact questions, you're not going to be allowed to come into the building. So if you can answer that question before you come to work, then you can get ahead of what's going to happen when you show up at the workplace. Now there are specific procedures to follow up with your chain of command and follow up with medical if you do answer yes to any of those questions. I personally carry this thermometer with me everywhere I go and take my temperature multiple times a day as part of self-monitoring. And then second, when you show up at the building, everyone's doing a little bit different, but for our buildings and coordination with Fleet Forces Command, they're handing out these wristbands that you'll wear, and that way you won't have to screen every time you go into the building. So the next question is, what happens if someone has a fever and what will be done? So if you do have a fever, like I said, you won't be permitted to come into the building, but that triggers the command response to support you for getting you the medical care that you need. There's the COVID-19 hotline. So the first step is likely you'll be told to call the COVID-19 hotline, answer those questions, and then that will determine your status. But if you are experiencing symptoms, if you do have a fever, most likely you're going to go into a quarantine status. And there's a whole host of processes and procedures we have in place to support you if that's the determination. But most importantly, if you are experiencing fever or any symptoms or you can't come into the workspace, I need you to contact your chain of command and let them know what's going on. And I need you to understand the requirements to get in touch with medical. And we'll help you understand that when you contact the chain of command if you have any questions. So the 4th question, if an employee is diagnosed with the coronavirus disease, there's a chance that employees who work in the same space may have been exposed. What is done in that situation? And would the possible exposed employees need to know that they may be at risk? So for us, there's a very clear process if someone is diagnosed as COVID positive. First of all, anybody who's diagnosed as COVID positive, whether they are symptomatic or not, goes into isolation. And what that means is that because they've been diagnosed, they're contagious, and we have to take all measures to protect them and protect the people around them. So within NSA Hampton Roads Command, we've developed a checklist that all the department heads have and are working through their understanding of how we support those personnel who are in isolation. The important thing to understand is if you've been diagnosed COVID positive, your interaction with anybody is limited to medical professionals who are wearing the proper PPE. And I can't emphasize enough how important that is for everybody, not just for the person who's sick, but for their family and for everybody, their neighbors, their friends, and everybody they work with. So if you are diagnosed COVID positive, or anybody who is diagnosed COVID positive, we'll have a very specific conversation about what you can and can't do in that situation. For the folks that work with that individual, we do what's called a movement and contact tracing. And so we'll interview the individual who's been diagnosed and go back to the onset of symptoms and then 48 hours prior. And we'll have them identify everybody who they've been in contact with and everywhere that they've been. And we'll start expanding that bubble of people who may have come in contact and notify them. Per the CDC and Navy guidance, anybody who is in contact with someone who is COVID positive, whether they have symptoms or not, goes into quarantine. And so once again, back to that department checklist, we'll take very specific steps to let you know what you need to do and to support you when you're in that quarantine status, because there is restrictions, significant restrictions on what you can do when you're in quarantine. And as the command, I think we owe you that support when you're in that status. What is this, the rest of it is, the command owes the cleaning of the space that an individual was in if they've been diagnosed COVID positive. So there are specific Bureau of Medicine and Department of Health guidelines on how to clean a workspace. And all of our departments have been given that guidance. The Public Works Department has amended contracts with our external cleaning companies to support us in cleaning the workspace after a COVID positive diagnosis. So there is a very specific process that's triggered, and to protect people's personal information, we won't publicly disclose that someone has been diagnosed COVID positive. But through that contact tracing, if you are in close contact with someone who has been diagnosed as COVID positive, we will notify you, and as a result of that, you will be required to quarantine for the 14 days per the Centers for Disease Control. So question number 5. Recent DoD policy requires all personnel to wear a face mask when social distancing efforts are difficult to maintain. How will the command implement this new policy? So, as a naval installation, we'll adhere to and follow the current DoD policy on wearing face coverings. We continue to implement and follow mitigation measures to limit the spread of the coronavirus disease. The guidance from the Navy, from DoD, is face coverings should be conservative in appearance, not offensive, conform to Centers for Disease Control and Prevention guidance, and acceptable to be worn in uniform. So, some guidance on that. The face coverings need to fit snugly but comfortably against the side of the face, be from nose to chin, be secured with ties or ear loops, preferably include multiple layers of fabric, and if the material is cloth, and allow for breathing without restriction. So, one exception is full face coverings, ski masks, those types of things aren't authorized. And it is authorized that they be handmade. So my wife and I this weekend, when the guidance came out, and we had actually started this about a week ago, started going through looking for old t-shirts and bed sheets and things like that, and found on the internet a good pattern for face masks, and we made our masks. So this is what it looks like, and this is, to me, conservative in appearance and acceptable. Now I'm going to take it back off because it's probably hard to understand me. And when you come through the ECP, the Sentry may ask you to lower the mask to assist with identification. If you have specific questions, you should contact your chain of command. Additionally, the Navy has indicated that there will be an official Navy face mask for military personnel coming out at some point. I'm not exactly sure when that is, and I've asked Command Master Chief to follow up, see if we can get any indication from the Uniform Board. But, as a reminder, it is a requirement on DoD property to have a face mask and to wear it if you can't maintain social distancing standards. Thank you. So as I hope it's clear to everybody through this very brief question and answer session, the email that I sent and the communication you're getting from your department heads, the spread of this disease is something that we take very seriously. We all have to take it very seriously, on duty and off duty. The governor's executive orders apply to all of us when we are not at the workspace. And when we are at the workspace, I think we're doing the best that we can to maintain that social distancing, to cancel events, to do telephonic meetings when it's practical. We have absolutely implemented a very aggressive teleworking policy. We have people on weather and safety leave. All of that is designed to contain and limit the spread of coronavirus and COVID-19. We all have to do our part to contribute to that. And for our military personnel, in case you were wondering, it is a lawful order that has been issued to practice social distancing, to limit those public gatherings, to limit the places that you go out in town. For our civilian personnel, it's highly encouraged because we all succeed and fail together in this. And the risk that we take in our personal lives when we come to work translate to risk that we are imposing on those that we work with. So I'm asking all of you to really be very diligent about where you go, what you do, and how you treat this disease outbreak. Admiral Rock the other day sent out an email, a policy that he's implemented at SNRMA that I think is something that I've personally adopted, and that is I have a running log of everywhere I've been and everybody I've been in close contact with for the last 14 days. Because if I'm diagnosed as COVID positive, I will absolutely tell you that I have been, and I will tell everybody that I've been in contact with that I have been. Because I feel like I owe that to the people that I work with and the people that I love and the people that I care for. And I ask that you do the same thing. Be deliberate about who you interact with, keep track of who you interact with, limit those close interactions with people to include your family, and be prepared to be honest with people if you do get diagnosed, because that's the only way to protect them. Now, before I go, there's a lot of stuff that we have that's sort of regular drumbeat things in the Navy that are also very important. April happens to be a very dense month of events for the Navy and in our behavior continuum. So April happens to be Sexual Assault Awareness and Prevention Month, Child Abuse Prevention Month, and Month of the Military Child. And so even in this uncertain time and these very unusual conditions that we're in, those things that we do on a daily basis, on a weekly basis, on a monthly basis, those have to continue. And so our recognition of Sexual Assault Awareness and Prevention Month and Child Abuse Prevention Month, especially now, especially with as uncertain as things are, I think takes on even more importance. The Month of the Military Child, also a very important recognition, especially in these uncertain times. Everybody who has a child, I think, is going through the same phases of, really the phases of grief, the phases of uncertainty. If you need help, if you have concerns, our Fleet and Family Service Centers are ready to provide that support. We've got Military One Source. There's just a multitude of resources out there to help support families in this time. So I ask that all of you think about that. Manage your stress personally and for your family. Talk about what is bothering you. Talk about how you're dealing with the challenges. And let your chain of command know what's going on if things get overwhelming. So this probably going on a little bit longer than what the Public Affairs Officer intended, and I apologize for that. I think the next couple of these will be a little bit more concise, but I thank you for staying with me to the end of this. That's all for this week's video. Everybody please stay safe.